A lot of patients that present with head and neck discomfort, TMJ disorders, bite issues can actually benefit from neuromuscular dentistry. So what I like to do in neuromuscular dentistry is capture objective data using computerized instrumentation to help me diagnose, assess, and evaluate my patient's existing conditions. I want to know what the joints are doing, what the muscles are doing, and I also want to be able to track that jaw in real time. So by using computerized instrumentation, I'm able to then record muscle activity. I'm able to actually listen to the joints through what we call sonography. So now I have a pretty clear understanding of if there's any pathology or disease going on in the actual joint. And then I'm able to actually scan the mandible in real time with simultaneous EMG or joint activity and see where that mandible wants to position itself. So then taking all that information and recording all that objective data, I'm able to then devise a diagnosis and formulate a treatment plan to move forward in helping these patients get out of pain, head and neck pain, discomfort. So what I like to do is by utilizing the data, I can then diagnose this patient and move forward with some long-term or short-term therapy to get that patient out of pain. And then what do I do? Well, after we have captured the objective data, then I want to ultimately find a new physiologic or what we call neuromuscular position of the jaw in relation to the rest of the head and neck. So by putting this patient through a procedure called TENSing, which stands for Trans-Electrical Neural Stimulation, and it's an ultra-low frequency which we are able to relax these muscles, recondition these muscles to bring them to a more physiologic or resting state. After we've been able to achieve that, then we go ahead and refabricate what's called a orthotic, which is a piece of plastic that basically just sits on the lower jaw and positions that mandible to a more physiologic environment. A lot of times, after we put these patients through these neuromuscular workups, they feel pretty good. Their headaches, they've gone away. They don't have the TMJ discomfort like they did before.